Nearly half of all American adults have high blood pressure. Here's the scary part. Only 1 out of 4 have it under control. Are you one of them? For those who don't even know what hypertension means, it is systolic blood pressure greater than 130 and the diastolic greater than 80. That's it. That's simple. That's the line. It used to be 140/90 until the guidelines changed it because we noticed that damage to organs in the body starts earlier. I mentioned systolic blood pressure. This is the pressure when your heart beats and pushes blood out of your body, while the diastolic blood pressure is the pressure when your heart is at rest, more like the pressure in between both heartbeats. If your blood pressure is less than 120/80, keep doing what you're doing. If your blood pressure is between 120 to 129 and the diastolic is less than 80, that's the warning zone. You need to start making lifestyle modifications so that you don't slide into being hypertensive. Stage 1 hypertension, where treatment is needed, is when you now have a systolic, that's the upper number, is more than 130 to 139, or your diastolic, which is the lower number, is between 85 to 89. Stage 2 is greater than 140/90. At this point, you definitely need treatment. As a matter of fact, you may need multiple medications. It is time to call 911 and go to the ED if your systolic blood pressure is greater than 180 and or your diastolic, which is the lower number, is greater than 120. At this point, you are having a hypertensive crisis and we need to act urgently. Here is why it matters. Hypertension is a silent killer. You feel completely fine when it is busy damaging your brain, your heart, your kidneys, your eyes, and even your blood vessels. The scary statistics about hypertension is that it increases your risk of stroke and a heart attack by 2 to 3 times. And most people have no symptoms until something catastrophic happens. Here's what you need to do. Get checked at your doctor's office, at your pharmacy, or you can buy a blood pressure monitor at home. If you want to check your blood pressure, then it's worth checking it. Sit quietly for 5 minutes. Make sure that both feet are flat on the floor. Have your arm supported. Check it twice, 2 to 3 readings, 1 minute apart. Track the pattern. One high reading doesn't automatically mean hypertension. Your doctor needs to know what the reading has been over multiple times. White coat hypertension is real. Up to 30% of patients have elevated blood pressure when they come to the doctor's office. That is why physicians or your primary care doctor needs your home reading to better understand your blood pressure pattern. If your blood pressure is 130/80 or higher, you need specific lab tests to figure out why and if damage has already started. I break down all 4 categories of tests that you need for this in my next video. Comment your blood pressure below and I'll tell you what category you're in.